Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing a topic really pertinent to this time of year moving forward, and that is the use of what we call sometimes ancillary benefits, or programs that are designed to pay on a fee-for-service basis outside of the base medical coverage that a person has, be it an under 65 or group plan, or more pertinent to our discussion, since we concentrate more on the Medicare market, for those folks that have selected nothing, a Medicare Advantage plan, or a Medicare Supplement program. Today's focus is on the cancer and critical illness programs. We feel this is really pertinent for our time today because as we roll into AEP, the Medicare Advantage programs that we write, because of CMS regulations, you're not compensated on them until after the first of the year. So not only does this program supply a solution to a need of our prospects and clients of how to come up with monies to deal with these illnesses, but it also gives us an opportunity to basically prospect in a different fashion, also create another revenue stream for our agencies, but also do so in a timely fashion because these pay as they are issued and you don't have to wait until the first of the year. A bit of housekeeping. Today's presentation is being recorded and it will be sent to everyone who RSVP'd for today's webinar, along with some of the other information that we referenced throughout the course of the presentation. So you'll have that coming to you very shortly. Watch for that if you would, because we're trying to do some things different with linking to the material versus attaching it, and we're seeing that sometimes when we send it out on a blind copy, it may go to your spam filter. So please watch for that or drop an email. We'll have contact information in just a second. You'll also note that in the webinar package, the software program, there is a section for questions. If you would, please put your questions in that section. We've muted everybody to keep out the background noise and the feedback, but we also generally cover many of the questions through the course of the presentation, and if we don't, we're going to make certain that we address those as we wind up today's presentation. We'll start with basically a little bit of a level set on information about Premier Marketing. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance products to the public through independent insurance agents such as yourself. And that arrangement is facilitated by contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, being founded in 1968, that means we recently celebrated a milestone in our history, our 50th anniversary, and we feel that's quite an accomplishment for what began as a small family agency in rural Nebraska that's become one of the largest marketing organizations of its type in the country. We do so through that full portfolio of insurance products that are available to you, including the base programs for the Medicare coverage on a medical basis, including Medicare Advantage and Medicare Supplement plans, and the standalone Part B prescription drug programs. But we also offer a full portfolio of life insurance and annuity products, and that includes final expense life insurance, pre-need plans, long and short-term care programs, disability income programs, and the topics that we're covering today fall into the ancillary benefits category, where we offer a full range of dental, vision, and hearing products, critical illness and cancer plans, today's topic, and hospital indemnity programs. Those we'll reference today as well. When you look at the Medicare Advantage portfolio, it's got the national carriers in there for you, along with some of the strong regional carriers that make a difference for you in your market. And that same philosophy carries over into the standalone PDP portfolio, where those national leaders are there for you through our organization. You'll note in this particular slide that we still list Envision RX. That carrier has pulled distribution from all the broker channel. It's going a different direction, renaming their product. I'm preaching to the choir if you have clients there. So you see information coming to you about doing certifications to make certain that you can continue receiving compensation for your efforts. And it's a reminder that in the world today, we've seen some very interesting offerings in the PDP world. So there may be alternatives outside of that program that could be helpful for you. We just wanted to point that out. When you look at the Medicare Supplement portfolio, it's very large, robust, and you've got a number of tools we've put in play to help you be successful in this portion of our industry as well. And when we look at the ancillary products in those 4 categories, sometimes when you mention one, it brings up the topic of another. So we've listed them all here. We'll concentrate on CI and cancer today, but many times some of the things that we're looking for coverage for these types of physical maladies may be available not only on this stand-up basis, but also as a rider on another type of program or through some life insurance programs that allow you to advance benefit as well. So keep that in mind, and we'll run through these in just a moment. When you look at the Medicare market altogether, if you're looking at it from just sheer numbers, you don't come on a program like today without someone talking about the silver tsunami, the aging of the baby boomers, 10,000 people plus a day, 1 every 10 seconds. So I guess I reiterated that for you just in case you haven't heard it a million times. But if you're looking at it just as the folks that are over the age of 65, you're missing part of the picture, because some of these people do not access all of their Medicare benefits when they turn 65. They may continue to work. There may be another reason why they don't. They may still be, however, a prospect for some of these ancillary products, and that makes a nice difference to us. Skews down the overall number based on age, but we also are able to offer programs to people who are under the age of 65, and nearly 1/6 of the Medicare population receives their Medicare benefits because of disability under the age of 65, and that's an important segment for us to consider. These are some folks that you may meet during community type of grassroots outreach, particularly in the retail sector we see with the Walmart or carrier programs. So this is a viable prospect in many cases for what we're offering on the topic today. That Medicare population is, well, it's not only large, but it's really varied. And you have folks that have some challenges that are on Medicare. 2/3 of them have 3+ chronic conditions. So they're very aware of the needs for additional help on programs like what we're discussing today, because it not only helps with the cost of those particular treatments, but it also helps them budget, because many of them have challenges with their income and assets as well. And this really helps out with those costs that may not be purely medical or may not be covered by one of the programs that are base programs that we consider as health insurance, because they have choices. When a person comes on Medicare, they don't have to do anything at all. They don't even have to take up the optional Part B if they don't want to. Most do. And most of them then look at, okay, am I going to self-insure for the difference when the other needs that I have? Or am I going to pick up coverage for medications with a standalone Part D? Am I going to couple that with a standardized, modernized Medigap policy, a Medicare Supplement program? Or am I going to go the Medicare Advantage route, the Medicare Part C programs? In each of the choices that we look at here, they have options, and they can choose to do nothing. They can choose to go one of these routes, or they can also choose to go one of these routes or not and pick up ancillary coverage for specific expenses they may anticipate. What we're seeing when people do come on Medicare is it's a pretty even split between Medicare Advantage and Medicare Supplement plans. I know some of the Med Supp agents out there now are probably going, yeah, but if I give them a G, all they've got is that Part B deductible they've got to satisfy. We're going to be pretty good there. I think you'll see through the course of the presentation, no matter what category they're in, there are expenses that aren't covered on a medical basis that really need to be considered, and we'll go into that in some detail. Since we are in the Medicare world too, sometimes it helps to have a translator along. So part of the follow-up you'll receive is a guide to an acronym guide here, a link to an acronym guide is what I should have said. So you'll have information where you can access and figure out, okay, what are they talking about by ALJ? I've been working the Medicare world for nearly 40 years now, it seems, and if I didn't look at administrative law judge, I wouldn't know. So these are things that might be helpful for you, and it's important to note that it reminds us as well that as we present and we provide information, that we translate as we go along, that we're not dependent upon these acronyms. We're speaking out what a annual notification of coverage is, an ANOC. Why would they know otherwise? So some different things that can be helpful, not only in translating the acronyms, but also reminding us not to use as many as we could. When we look at selling cancer and critical illness programs, one of the first hurdles we feel that an agent has to overcome is the perceived value of these programs. So we'll go through and talk about costs and different things of that nature. But if you look inside yourself and realize how many people that you know may be related to you, hey, it might even be yourself that have fought cancer or some of the critical illnesses that we'll discuss, you'll realize the expenses that aren't covered by just medical insurance, and that this is something that should be near and dear to your heart because it can make a huge difference in the lives of the people that are fighting these physical maladies. When we look at what is covered by Medicare, we've got a whole bunch of different things out there that can help us. There's the new What's Covered app that's available. There's the Medicare and You handbook, which, well, everybody's going to get mailed one in October if they haven't already opted into the e-handbook, is what we see here. And it gives us information as to what is or isn't covered, obviously. And one of the first things is if you encounter a person who made that choice not to do anything additional, it speaks to the out-of-pocket expenditures that are necessary, using 2020 numbers here, based on no other coverage. And these are folks then that realize that they have 2 deductibles, other out-of-pocket expenditures, including co-insurance, and no coverage for programs that aren't approved by Medicare either. So it gives us a base for discussion, particularly when you're talking with the folks that haven't added any other medical coverage. It also gives us an opportunity to speak to the fact that hospital stays are very expensive, and much of what we speak to about the illnesses today bring up that cost. Because if you look at Medicare Advantage programs, this is one of a few key areas that can really push a person to that maximum out of pocket that they have on their policies and do it really quickly. And most folks, as we saw in the description of the Medicare beneficiary, don't necessarily have that kind of money that they can just write a check for. So we want to make certain that we're taking care of them in a hospital stay or to protect them for outpatient procedures as well. There are hospital indemnity programs, and we discussed this a bit yesterday on GTL's presentation and last month on an overall hospital indemnity type of program similar to today's, that you'll get links to those recordings. But we realize that it can get really expensive in that max out of pocket. Well, gee, it's been $6,700 going into 2021 because of some of the inclusions and changes in the regulations as to what's covered. And hint, nudge, nudge, the whole ESRD portion of this. These out-of-pocket maximums may be higher in many plans than what they have been in the past. And if you're looking at a program that's on a split platform, an HMO PPO program, they may have 2 different out-of-pocket limits to satisfy as well. So it gives us some basic information as to some of the financial exposure that people have with hospitalization and with out-of-pocket costs, particularly on the Medicare Advantage programs. And as I mentioned, a whole bunch of folks wouldn't have the money to come up with to take care of the dollars that are being spent on them that they are spending on their health care as well. And so we want to make certain that we can help them in that regard. When you look at our ancillary products in this area, the critical illness and cancer plans, there is a wide variety of carriers that are available to you. And some of them work hand in hand with the hospital indemnity programs. It may be a combined program, or it may be a circumstance where it leads to a discussion of one type of program or another. There are a lot of programs out there that emphasize the inclusion of a hospital indemnity plan when you sell a Medicare Advantage plan, because it's, 1, kind of easy to do, and 2, it's a natural topic. But many of those also have an ability on a HIP plan to put in a rider for critical illness and cancer plans. Depends on the carrier. an inevitable question is, okay, who's the best one? You know, that's kind of like choosing between your children in certain circumstances, because some of it varies according to the amounts that you're looking for, the types of requirements you have to satisfy in order to get someone into the program. Is it a guarantee issue? Do they have to qualify? If they do, what are their requirements? The limits that are part of it. And then in many circumstances, what is their critical illness, for want of a better term, hot button? Which critical illness is a key component that they want to make certain that they have the resources to cover, because, well, they may have a health history with it, or they may have a family health history with it, that they realize that there may be a greater chance that they have to deal with that particular illness. So we'll touch on some of these, but in specific, but we also want to look at how easy these programs are to offer. And I'm not saying that you want to do what's not best for your client because, hey, this one's easier, but you have in many circumstances, based on your entry into the home, an opportunity to do a combined application, perhaps with a Medicare Supplement program, augment a Medicare Advantage plan by a fill-in-the-gap program that I'll show you in just a little bit. And that gives you an opportunity to make certain that, do I want some name brand coverage? Do I want to make certain that I can get maximum amounts out of this? Because they all have different levels and requirements. And that's something that is a great discussion for you and your marketer, because that can be different in different areas. Not all companies offer all these plans in every state in the country. So we want to make certain that we speak to a program that isn't some kind of Xanadu fantasy. It's something that we can actually deliver upon with the carriers that we're working with. That same sort of information that may be helpful to you as a third-party influencer is the information on different programs that are put out on the base plans and are provided to us by the government. CMS does put out some very nice publications, some of them a little long, some of them requiring translation on our part. Remember that acronym JIVE from earlier? But you have them for both Medicare, the Medicare and U piece. It goes through a whole bunch of different things. You have a publication that's available to help you be more comfortable with the ins and outs of Medicare Advantage plans and what comes and what doesn't. And you have information about the Medicare Supplement programs post-MACRA. The institution changed a little bit as to what we can offer for someone with Medicare Supplement plan choices based on when they received Medicare coverage. They've got to have Medicare coverage in place before the 1st of January in 2019 to be eligible for a CNF program. Remember, they didn't go away. They just aren't available to folks who got their Medicare after the 1st of January in 2019. And these cover medical expenses, not some of the other expenditures that we'll talk about. One of the things that we like to use to help in this regard is one of the pieces of our Medicare Center program. The quoting tool from CSG gives us some information on how we can address some of the needs of folks that select a Medicare Supplement program by going in and look at the different programs that are there and pull up some different information on hospital indemnity programs. The cancer programs, we find that in many circumstances, agents will discuss that in conjunction with the Medicare Supplement carrier information that they are providing, because many of the Medicare Supplement carriers, their e-apps will also help you with a combo sale and make it much simpler to complete that process as well. This is the portion within the CSG program that allows you to go in and select an MA program, and that's their base. Use that as their base coverage, and then fill in the gap. We'll send you a link to this presentation. It's a little over 15 minutes, and for me, you know, those of you that have said on these webinars, go, gee, he likes to talk. That's short for him, but it concentrates on that cross-selling opportunity, and it gives you then the opportunity to fill in with a hospital indemnity program based on the daily copays or the per stay copay that a person has with their MA program. Really slick tool to use. When you look at cancer critical illness programs on themselves, they are programs that are paid on a fee-for-service basis. So it doesn't matter what kind of base medical coverage there is in the household. Are they still working and have for want of a better term, an Obamacare, an ACA program? Are they covered by group coverage at work? Do they have any other coverage at all? Do they have any coverage? These aren't intended to be base medical coverages. They don't satisfy the requirements to get out of the penalty if it's there or not for the ACA programs, but it is also a program that pays on whatever type of base coverage they have once they're on Medicare. So if they have Medicare A and B only, or if they've picked up the MedSup or the MA programs, they're going to get paid by these plans regardless of that other coverage. And they may pay out differently. Obviously, it depends on the amounts that you select and how it's to be paid. Many of them, when you look at these type of physical challenges, there's a single payment upon diagnosis and treatment. There are also programs that will pay as you go and you encounter different circumstances that require out-of-pocket expenditure. So they have different types of coverages that we can discuss, and that means we need to know basically what we feel is a good alternative for them, which carrier can be helpful to us in that regard, and then how do you approach that sale. Some of the critical illnesses that are out there, this is much like the presentation I do on chronic special needs programs, is because there is a illness or condition that's listed here doesn't necessarily mean there's a plan for it. These are the conditions that many of the plans will cover in one instance or another. The most common ones we see, of course, deal with cancer, heart attack, and stroke. Those are the ones we run across most frequently. But if you talk to an individual who's had a family member that's had ALS, or they're dealing with Parkinson's or some other illness, that may be the program that is most important to them because they feel that is a more likely circumstance that they may encounter. And so we need to have that in our pocket too to see how can we go beyond the most commonly offered benefits as well. One of the big attractions for these programs, obviously, is if you've had one of those illnesses yourself, you may have one of these plans on yourself as well. I've gone through a couple of different things with my health and have been fortunate enough to have a couple of these plans in play. It's a check directly to me, non-taxable, and can make a huge difference on some of the things that may not be covered by the base medical. You know, your deductibles, your co-insurance, obviously, but Medicare health programs only pay, particularly Medicare supplement plans, pay based on what Medicare approves as treatment. And in certain circumstances, for some of these illnesses, some folks may reach beyond some of the traditional means of treating them, and they'd have to come completely out of pocket for it. So they'd have to look for critical medical services that might otherwise be unavailable, programs that aren't covered by a traditional policy, and then there are all the other expenses that come about that aren't medical in nature, but are part and parcel to that particular condition that they're dealing with. A lot of folks, when they go through chemotherapy, they can't work. You have a stroke and you have some after effects, obviously you can't work. So there are different things that come into play that if there was another program to help with not only the monies that are coming out, but also the monies that aren't coming in, that can make a huge difference. And as we have seen in many circumstances, folks that have these conditions may require additional transport costs, some different things that come into play when it comes to lifts and retrofitting houses. If you go in and you have a stroke and you're in a wheelchair, you have to widen the doorways. There's a ramp necessary for the help. Can you get some help to cover expenses until you're accepted into a long-term care facility or in a skilled nursing facility as well? We run across a lot of folks that say, oh, I got a VA, I'm going to go into those particular facilities. My older brother had a massive stroke 3 years ago. He's a veteran. It took him quite a while to get into a VA facility because there's a waiting list. So there are considerations like that we have to look for and accommodate the relief for those programs. And then there may be circumstances too where certain people, if they're at a point in time and they just decide not to pursue additional treatment. That's their right. They may be simply looking for some monies that can help them enjoy the time they have left. And that sounds a little bit macabre, but it can make a huge difference when it comes to peace of mind, not only for the person fighting that particular illness, but also those folks that are the caregivers or the family of that individual, and ease some of that pressure. Some of the things we see and we need to take into account, you guys look into your heart, literally, every 40 seconds, someone suffers a heart attack or a stroke. You don't know when it's coming, obviously. You don't always know how much it's going to cost, but you know it's going to be a bundle if it is a trip to the hospital for whatever stay is necessary, into a skilled nursing facility, into a long-term care facility based on some of the challenges that we have when that condition affects us. And there's a ton of dollars that are being spent on cardiovascular disease and care. 1 in every 6 healthcare dollars deals with cardiovascular disease. And you look at some of the expenses of just specifically, okay, I got to have a heart valve replaced. Look at the dollars that are going out for that type of care. And then we see different types of heart disease as to the astronomical amounts that are being spent in this area. And it's not getting lower. We as a society, particularly in our country, we tend to be a little heavy. We tend to help bring on some of these challenges by things we don't do. We don't exercise in many circumstances. We don't necessarily adhere to our prescription regimens. Whatever it happens to be, it's not going to get any cheaper. And as we are able to lock in these benefits at a younger age, the programs are less expensive. So keep that in mind. When you look at some of the expenditures that come out based on cancer coverage, you got a ton of money that's being spent outside of a hospital. So there is a natural discussion for a hospital indemnity program, and it may allow you, depending upon the plan you select, to add riders for other things as well. But keep in mind, 42% of the cost that you deal with cancer type of expenditures are non-medical to a degree. So we need to make certain that we have an avenue to take care of them, because that illness particularly requires surgery quite frequently. It may require transplants. It may require inpatient radiation, all of which are expensive and all of which are, in many cases, part of the uncovered expenses that drive a person to drain their bank account and have an opportunity, and that's not meant in a positive way, to reach their maximum out of pocket on MA programs particularly. So if you think about it, the biggest challenges with MA plans: hospital expenditures, DME, which is durable medical equipment, which you deal with a lot in critical illnesses, and therapeutic treatment for radiology. In those circumstances, a lot of the MA programs have a 20% co-insurance that can drive you to that max out of pocket really quickly. Having plans like this can make all the difference between someone having the funds to pay for their particular challenges or not. One of the things that we see as well, since many people that come on Medicare continue to work, well, cancer treatment sometimes takes them out of that, and that is a huge number based on information from the Journal of American Medical Association from last year that tells us of that astronomical amount of money that is basically attributed to lost earnings. And that's a big thing to consider, particularly if we're working the Medicare market and you got folks that are continuing to work past the age of 65 or their Medicare eligibility. Some of the things that come out of pocket that aren't covered by traditional medical expenses, obviously travel. Some of the treatments may be non-traditional or not approved. You also have that lost wages component that I just referenced. And when you get home, who's going to take care of you? The home care and caregiving. If that's a family member, you still need to make certain that you look at some of the things that are necessary to help that individual not burn out, respite care, some of the other things that come into play. So with this cancer challenges, you have all these expenses. They may require different types of diet. They may require challenges on the beneficiary's part as to how carefully can they follow the regimen that's been sent to them because they can or cannot afford it. The medications for these things are incredibly expensive, and in many circumstances, there's not assistance programs for them, and they may or may not be formulary drugs for some of their programs. I am fighting cancer myself, and I have 2 medications, a total of 24 pills that I take on a regular cycle, a biosimilar chemotherapy medication regimen, that those 24 drugs, if I were to buy them without insurance, would be $37,000. Moment of silence to let that sink in. Not a lot of people can make that kind of expenditure, write a check for that kind of money each and every month, because that's a monthly number. So we look at that and we look at these numbers and we realize that, okay, one of the reasons many people declare bankruptcy is because of medical expenses. So we look at all these indirect costs and take those into mind as well. And it behooves us to look into our own situation. What is our own coverage? Do we have one of these plans on ourselves? Did we select it based on our family history or some of the things that we've gone through as well? Because there's nothing as powerful in a sales presentation when you're able to tell your prospective client, hey, I have this coverage as well. It's my own bank account endorsement of these types of policies. And our realizing the value of these plans for ourselves and the people that we talk to can make a huge difference. You can never undersell passion when it comes to a sales presentation. And what we see too is folks that are affected by these programs, well, the incidents grow much more frequent as we age as well. So even though we may concentrate on the T65 market or on some of these programs, since they may have a guarantee issue period between 64.5 and 65.5, we're using it as a gatekeeper bypass to get into a household to discuss the need for that GI period and the need for locking in a lower price. That becomes a great motivator as we talk to people who are aging as well. They have long since passed a GI issue in many cases, but that need may still be there and they still may be eligible for the programs. So when we look at the ancillary product itself, let's highlight just a few carriers. Let's look at some of the tools that are out there that can help you sell. Aetna Senior Supplemental Program has a great program that can help you with a cancer heart attack or cancer heart attack stroke or one or the other. And they have great online enrollment tools that can help you with those programs, e-apps that can deliver on that value. And if you're in that household selling an Aetna Medicare Supplement program, be it whatever version of it will be, you have then the opportunity to use their e-app and simplify the enrollment process for all the plans that you're adding, be they the base Medicare Supplement program, the heart attack, cancer, stroke plan, and whatever derivative type of plan you are offering. And then, of course, a lot of people ask for the dental, vision, hearing products. You can bundle in terms of American pickers and bring it on. They also have great tools that you're able to use with preset videos that help you explain the program. And this may be a circumstance that as you are finishing up the base medical coverage, you've noted on that scope of appointment that you're going to talk about their health options. So you've marked for these types of programs as well. You can be completing an application and playing this video for them to help explain these videos for them to help explain these programs offered by the carrier. GTL does some of the same things with their programs, particularly the cancer, heart attack, stroke programs are more of an adjunct to their hospital indemnity programs, but they have some great tools that can help you sell these programs and explain them properly. Heartland National, they have some really great agent support on the back end, quick turnaround on these policies as well. You'll see that in most circumstances. It's, yep, you got it, or nope, you're declined. And it's a great way to not only close that business, but get paid faster. Now, all that emphasis you're hearing on e-apps just speeds the process up for everybody. years ago when I was the regional for a C-SNP program with a MA carrier in the Midwest, our C-SNP programs, the applications that went in, 70% of those applications were pended because folks looking to input that information, not just underwrite it, input the information into their systems, couldn't read our handwriting. So it slows the whole process down. And we realize that when you work with intangible products, we have to make certain that we can positively reinforce the decision that our prospects and clients makes. And that entails, to a degree, shrinking that time period between when they apply and when they have that coverage. When you look at SureBridge, they've got some different things that come into play there for you as well. Great electronic tools, strong product, and a great way to cross-sell and sell based on multiple signature options. You'll see this with most of the carriers now. That's one of the many things that COVID-19 has done with our industry is affect how we are selling these plans as well and how we are enrolling them. Many of the carriers have come out with these great ways to make that as simple as possible for our prospects and clients. And we still have a means to enroll them face-to-face. There are email options, voice signature in many circumstances, text, and of course, everybody's Zooming nowadays, so there's screen sharing and some of the other things that can come into play as well. You have other carriers too that will also help you in the marketing of these programs. Most of them will, but there are some unique things that some of the carriers will come up with when it comes to how the product brochure looks. If you're doing some things remotely and you're talking to someone on Zoom or Skype or whatever it happens to be, what kind of background you can influence on the area that's seen behind you. Some neat things that can really reinforce your message that's put out there by these different carriers. And they'll give you a path in many circumstances to be successful, not only with the product, but also with that type of presentation. I know many of us are like the cattle I used to herd in the pasture where they walk the same path all the time. Coming out of that comfort area, that comfort zone cannot be easy for everybody, and some of us will resist it, but we need to keep in mind in order to take care of our people and ourselves, we may have to step off our cattle path and approach some things a bit differently. Why? Well, because all these types of programs are all part not only of a comprehensive marketing program that gives us additional options to reach out to people, sell additional programs, most importantly, provide that additional coverage, but also do so in a integrated fashion where we can come up with a comprehensive plan of offering these in conjunction with the programs that may be the main thrust of our business or as a precursor to the distribution of information on those other programs. This is a door opener. I don't think you can talk to anybody in the world, particularly in our country, that doesn't at least know of themselves, a family member, a friend who's had cancer or one of these illnesses, or the news that's out there of folks that have fought these battles and bring these topics to front of media coverage. Black Panther lately, pancreatic cancer. God bless him. That's a painful one. So there are different things that bring this up as a point of discussion, and that may well be also a means of helping you discuss those programs. It is important that we know what the base coverages are for the plans that we have, or maybe even a carrier we don't offer that maybe we should, we need a contract for it, or we're selling against. And having that information is important. You have access to the 2021 MA benefits through our website at premiersmi.com that can help you in preparation for any of your appointments as well. And keep in mind, certifying for 2021 with these programs, in most circumstances, also makes you eligible to sell for the remainder of 2020. Most of them will apply those certifications across the board. That's really important if you've had a contract and you didn't put it in play, or there's a new one that you are working with, or, gee, I just haven't done my search yet. Well, make certain that you look at that from a viewpoint of it not only helps me next year, but it helps me for the remainder of this year. And I don't know about you guys, but I live in a suburb of Dallas, Texas. This week's been pretty mild. Last week, not so much. You could hear that electric meter spinning, and my neighbor across the street had nearly a $700 electric bill, 2-story big house. You still got to pay that bill. October, November, December. Having your duckies in a row and being prepared for these programs and getting compensated by them before the first of the year can make all the difference as well to ease some of the strains on our own budget. You do also have additional trainings that are available through the government as well. The Medicare Learning Network is a great program to go in and learn more about different circumstances, make yourself feel much more accustomed to the different type of delivery methods, and reference Medicare material put out by the government. We are in a strange part of history right now, unlike anything since the Spanish flu of 1918, I guess. And regardless of how we deliver on the information of these products and the enrollment of these products, we need to be flexible and be prepared to pivot, because sometimes a face-to-face presentation may not be eligible or may not be possible, I should say, and we have to do things virtually. If we're doing different types of seminar selling in certain circumstances, in different areas that may be allowed, in some areas it won't be, and you can then deliver this information on a virtual basis through a electronic means of delivering the information. Well, there's a whole bunch of talk about Zoom. There's a whole bunch of talk about GoToWebinar and Skype and a whole bunch of these different programs. We need to be proficient in those programs in order to properly deliver our product, maximize our time, and be prepared for what we don't know is the avenue we have to go down to sell. So when we look at how we can also look into getting in front of people for these programs, let's look at some of the other things that are available for you to use in that circumstance. Obviously, you can't cold call for Medicare Advantage or PDP programs. You can for MedSup, you can for dental, you can for cancer plans, you can for a whole bunch of different things. But that's a possibility to reach out to people. They may be new blood to you, or you may be working with the people who have done business with you in the past, or in some circumstances, even discussed doing business with you in the past, didn't do that, went another avenue, and you still have permission to call. It's a great way to reach out to them with another approach to grow your book of business. A lot of agents are very proficient at community-based marketing. There's a big push every year for the retail component offered by Walmart and the different carriers, carrier-specific ones. These type of programs are listed on many of the generic scope of appointments, and that gives us the opportunity to speak to them when we come across folks in that setting as well. You may not necessarily want to complete an entire application at a Walmart. That's up to you, depending upon the traffic flow and what you've seen in that particular location. But it is a great way to get that information to them and then do the follow-up close virtually. Great way of doing that. And then you have other centers of influence in the community that need your help with explanations as well. Approaching with a specific product like this may gain you access to different faith-based venues. Faith-based organizations like to supply information to their congregations. We have a complete set of steps for you to do to be successful in that area, but this can be a topic in your rotation on the seminars that you present live when possible, or if you're going to a virtual delivery of that information as well. Same thing applies to, the different providers. Many of these doctors, and I can tell you from personal experience, when they speak to you about the course of therapy, they talk sometimes about the different options you have about the therapy. They don't always talk about how much it costs and the things you have to go through outside of the approval process to getting those coverages in place for that particular program, approvals, pre-approvals, whatever it happens to be, but also the additional costs that come into play with that treatment. I ran across an article a few months ago that even talked about how just parking at cancer facilities can become astronomically expensive. Some of them will park your car free. Some of them charge you for it, and that may be just kind of like, gee, John, you're being nitpicky, but it's not, because it can add up, not only for the patient, but for the folks that are helping them access their care. And then you have other centers of influence in the community that can be useful for you too, different senior centers, assisted living or senior living facilities, different food pantries, a number of different locations that can be a distribution point for you through that center of influence in your community to get into a visit with folks coming forward. Some of the carriers will have different programs that help you access this market as well. We've seen through some of the brief slides that we talked about with the different marketing programs, how many of them have entire means, a path for you to follow to be successful in this area. And keep in mind, it may be a devotion to a particular cause. Hey, I've had cancer in the past. I fought it. I know how much it costs. I want to help people not go through what I went through. Or it may be just another circumstance of, I want to make certain I'm delivering on as thorough of coverage as possible, and I'm going to do it in this fashion. And they have different ways of getting you in front of people, not only the sales tracks or the videos or the different things that help you sell it, but also different social media programs that can put you in front of individuals. And they're preset, kind of plug and play with the different programs, keeps you out of compliance hot water in many circumstances, and certainly makes it easier for you to use that avenue of reaching out to the public. We do also have a couple social media campaigns I'll talk about in a second, but it's also very important that we never forget for the strongest value of a lead, and that's a referral. Because many times people will take out one of these programs because their mom, their dad, their brother, their sister, their children, themselves have fought these illnesses, and they realize the expense, and they know other people that have been in that battle with them. So it's a great way to get referrals, and it can be a great way to increase the return on your direct mail. A lot of folks at this particular point in time, since we're 1 week away from the marketing period, the first 15 days of the EEP before we can sell, they've put out a bunch of mail already. How are you going to differentiate yourself to get into homes if you hadn't done that, or if you want to augment that initial mailing that you have put into play? Because when you look at Facebook leads, we'll help in a couple areas. We've got a program that accesses and generates leads based on Facebook. They're approaching people for Medicare Supplements and final expense, and these programs can be purchased on a one-off basis. So if you go into a direct mail campaign without any assistance, a lot of them run $400 to $450 for a 1,000-piece mailer, and that may not fit your budget at this particular time. Well, if you picked up 10 Medicare Supplement leads through this program, that's less than half that cost, and you're looking at basically a 1% return on a 1,000-piece mailer. So it's a great way to access things at perhaps a more budget-friendly basis. But if you do that mail campaign, we do offer support based on production, where we're cutting that cost nearly in half in some circumstances. That allows you to do that consistently. Because that's the challenge we have with marketing programs. We need to do it consistently. It's like an exercise plan. If you do it once, you might get a little bit out of it, but you're going to feel the pain. If you do it consistently, that's where you see the return on your investment of your time and your dollars. And we use certain preferred lead vendors because we vet the letters that are going out, and we want to protect you when it comes to compliance concerns with some of the direct mail outreach. Number of great partners. You see on the top row the vendors we use in the Medicare market. You see on the bottom row the folks that we use as well for the final expense program. Two separate programs. You can use them both, qualify for both. So a great way to help subsidize the cost of your mail. We also have programs that will sell you direct mail responses as well. Very reasonable at that cost, and it gives you the opportunity once again to access someone who's raised their hand. Any of these programs, and you guys know this if you've done direct mail or even internet programs, sometimes people don't even remember that they did them. And sometimes if you're looking at a purchasing response versus an initial program, how old are some of those? They may not be old, they may not be age leads, but if you have your own campaign, in many circumstances, you're getting access to a person much more quickly, but you're paying for it. So that's a consideration to take into play. And of course, I cannot emphasize again the importance of reaching out to your current book of business with this coverage and the opportunity to review their coverages during the open enrollment period as well. As they used to say on Hawaii 5-0, dating myself, book them, Daniel. Get those appointments booked up front, and working your book is a great way to start. We've also introduced a improved version, a more comprehensive version of our Medicare Center electronic access program. These are available to agents contracted with us without cost. It helps us build a system not only to deliver the information and enroll people compliantly, but also educate them ahead of time to make that process quicker. So it's built to help us as agents. It offers a simplified CRM as part of the program. So if you're dealing with paper, Excel sheets, or whatever, this is a great way to use a client management system that can help you become more organized, stay organized, and not miss somebody as frequently. It is a program that accesses 3 different ways of speaking to people on different products, but there's not a separate login for each. There's an all-in-one universal login that can help you access these different programs. The one you use, well, it depends on your choice. We'll talk about that briefly. You'll get a link to a training on this as well, a recorded training. But we also offer resources within that package through the Learning Center that includes sales tips and carrier guides and access to different pieces of information that can make this process so much easier. These 2 programs are basically addressing Medicare Advantage and PDP programs. The Medicare app is powered by Connecture. The Medicare Link program is powered by Sunfire. So that people have different processes and preferences that of the tools they want to use. This gives you that opportunity all in a single space and still having access to all of those great newer tools to help somebody become enrolled, or actually even to speak with them, to do the electronic scope of appointment and to store it for that 10-year period that we're required to by the government for certain programs. It also gives us access to the CSG quoting engine with the Medicare Supplements that come into play. This is the program I referenced a little bit earlier that gives you that opportunity to look at these different programs in detail. Not a comparison tool for the Medicare Advantage or PDP programs, but a great way to get additional information on them. And it also gives you then the opportunity to use that fill in the gap function that helps you with Medicare Advantage programs and some of the expenses that can drive a person to their maximum out of pocket. It does have an e-app platform as well. It does have the scope of appointment as well. And I know there are some folks out there that say, well, hey, John, you don't need a scope for these ancillary products. You don't need a scope even for med subs, and you don't. But looking at that electronic scope of appointment, that generic scope of appointment, and the products that are listed there, it enables you to set up the discussion for other programs. Mr. and Mrs. Prospect, you're going to see a form coming to me. We're going to send you an email. It'll give you an opportunity to approve the discussion of certain types of products. I'd recommend that you initial each category so we can discuss a full package for you and make certain that you realize that you have additional options beyond your base coverage. Kick it back, it's stored compliantly and securely, and gives you then that opportunity to make certain that you also take into consideration, are they getting extra help? The median income for a Medicare beneficiary a year and a half ago was $26,200. You saw from a little earlier that it was $24,200. There are a lot of people out there that are getting some help with their medications, the low income subsidy extra help program. This helps you factor that in and be more accurate in your recommendations. It also has a newly released program that we discussed in a webinar yesterday about a shopping cart option. So this gives you an opportunity to build on Medicare Supplement sales as well, because it will help you cross-fill those applications, speed up the process, You're taking out a Medicare Plan N. You've got these co-payments that come into play. This can help you with these programs that help with cancer, critical illness, or even a hospital indemnity program, and product fills them for you. It also then gives you the opportunity to speak to the need for those additional coverages, even if they took out, well, let's say they're on Medicare before 2019, they still have a Plan F. Well, you still have these expenses in addition to the medical portion of it. That's why all the statistics a little earlier in the presentation. And that cross-selling across the board not only delivers that more comprehensive care, that additional means of marketing for you, additional revenue stream, but it also helps drive up your persistency. Studies have shown that when you have multiple products in a house, and they don't even have to be with the same carrier, the persistency grows across the board. They just have to be the same agent, and that agent's you. Some of the things we're going to do to additionally help, if you're looking to contract with multiple carriers, you can create an agent profile and assurance-based system, which gives you the opportunity to contract with multiple carriers electronically out of a single system that autofills different contracts for you. There are certain carriers that do not participate in this program. More do than don't, most certainly. And there may be different plans that you want to look at that can be simply made available to you through a contract by using this program. We also help protect your financial situation with discounted errors and admissions coverage for qualified agents. What's a qualified agent? Well, you got a contract with us. This is a standalone E&O policy, not like being added to a blanket E&O for one program or another, but it covers you regardless of the insurance product and regardless of whom you're contracting through. So it takes care of you in that situation. And an interesting portion for some of you that are involved in that, it does also help with covering mutual funds and variable products that many E&O carriers do not. We do also offer discounted continuing education courses through our association with WebCE to keep your license in play. You have an opportunity to add modified guarantee issued DI policies, disability income policies for yourself, and share in the commission as well, since you have to maintain your own benefit package. And much as where today's presentation is being recorded and will be distributed, it's also going to be made available like past presentations on our website at premiersmi.com or on our YouTube channel. So you can go back and look at specific carrier presentations, particularly if you want specifics in the cancer and critical illness programs. We've got a number of carrier presentations up there that will walk you through their details, but it also helps you with those marketing programs that we referenced earlier, how to approach providers, how to approach centers of influence or the faith-based community. And those are available for you 24/7 through this library of presentations. Carriers in this area too offer different types of incentives beyond the commission in many circumstances, so the different trips and incentives. Well, Medicare Advantage plans and PDP programs, that compensation is set by the government, so they don't qualify for these additional incentives like that, but these ancillary programs do, and they may help you qualify for trips or earn additional monies and help you qualify for the Premier's Producer Convention as well. That's all in a single spot on our website. And we want to make that available to you so you realize not only the spread of the product that you have available, but the different compensation programs that are made available to you. And we want to do that in order to earn your business, because it's a decision. We talked about the decisions the Medicare beneficiaries have to cover. This is also a decision for you as to, I want to make this part of my marketing program. I want to make certain that I do it correctly. I don't necessarily need 20 different additional carriers. What's pertinent for me in my market, playing with some of the enrollment tools can help you. A discussion with your Premier Agent Success Manager, your marketer, can make a huge difference as well. And that can be a key decision that helps you decide what you want to do, but also influence your financial future. You can reach any of us at Premier through our toll-free number at 1-800-365-8208. Speak with your marketer, or if you don't have one, ask for one, and they'll be happy to give you additional detail. There's also additional information available on our website at premiersmi.com. And looking at some of the questions, I apologize. There's some folks that are saying, well, one person, that the sound is tough today. I apologize for that. We've been having pretty good success with that lately. Sometimes in DFW, we've got some inclement weather periodically here. Perhaps that's influencing it, but we'll make certain that you get the link to this presentation, access to the different statistics and other programs that we've referenced across the way, and get you that information to help you with offering this type of program. And that includes getting you information on the lead programs and how you may be able to reference or utilize additional assistance, not only from your own marketing budget and our marketing budget, but how we can approach carriers to help make additional resources available as well. So that said, we've gone through about everything that we can today. We're 1 minute past the hour. I appreciate your investment of time, your most valuable resource with us here today. I feel some of this information can be a great factor in your financial success moving forward, but also in a mission that's near to my heart in dealing with these critical illnesses, fighting the expenses of cancer, heart attack or stroke or Lou Gehrig's or whatever other critical illness may be the kick point for you and your prospects and clients. Excuse me. So until we speak again, watch for that information that will be coming to you. We thank you again for the investment of your time. And until there are future discussions, we wish you good selling. Thanks so very much. We're hoping for the most successful AEP possible for all of us involved moving forward, but particularly for you and your ability to handle the needs of your prospects and clients. Once again, thanks so very much, and we'll talk to you soon.